Assalamualaikum everyone. Myself Asif Akram, representing Group 5. Today the topic of our discussion is hypopituitarism. We'll begin with a general overview of the pituitary gland.
So, the pituitary gland, which is the master gland of our body, is composed of endocrine cells and is a part of our body's endocrine system, which secrete hormone essential for homeostasis. The gland consists of adenohypophysis, which is known as the posterior pituitary, and the neurohypophysis, known as the posterior pituitary. The hypothalamus stimulates release and inhibition of the pituitary hormone. Neurophysis secrete oxytocin and antidiuretic hormone. The adenohypophysis is composed of three structures: pars distalis, pars intermedia, pars tuberalis. The pars distalis is responsible for the release of hormones that includes growth hormone, prolactin, thyroid stimulating hormone, follicle stimulating hormone, luteinizing hormone, adenocorticotrophin hormone, and the melanocyte stimulating hormone. So what does the pituitary gland do? It releases several hormones which are essential for the body's homeostasis, which includes ACTH, adenocorticotrophin hormone. It stimulates the production of cortisol, a stress hormone that maintains blood pressure and blood sugar level. FSH, follicle stimulating hormone, promotes sperm production and stimulates the ovaries to produce estrogen. Luteinizing hormone stimulates ovulation in women and testosterone production in men. Growth hormone helps maintain healthy muscle and bone and manage fat distribution. PRL, prolactin, causes breast milk to be produced after childbirth. It also affects the hormones that control the ovaries and testes, which can affect menstrual period, sexual functions, and fertility. TSH, thyroid stimulating hormone, stimulates the thyroid gland, which regulates metabolism, energy, and the nervous system. Oxytocin, helps labor to progress, causes breast milk to flow, affect labor, breastfeeding, behavior and social interaction, and the bonding between a child and a mother. ADH, antidiuretic hormone or vasopressin, regulates water balance and sodium level. And this is the diagram showing the pituitary hormones and their effect on the target cells. What is hypopituitarism? Hypopituitarism, also called the pituitary insufficiency, is a rare condition in which pituitary gland doesn't make enough of certain hormones. Hypopituitarism is when you have a short supply deficiency of one or more of the pituitary hormones. These hormone deficiency can affect any number of your body's routine function, such as growth, blood pressure, or reproduction. Hypopituitarism can be caused by tumors in or near the pituitary gland, which are usually benign. Radiation treatment, which can destroy the pituitary gland tissues. Pituitary surgery, bleeding in a pituitary tumor, traumatic brain injury, severe blood loss during childbirth, certain infections such as tuberculosis or meningitis, certain conditions present at birth, inflammation of the pituitary gland, condition that can infiltrate the pituitary gland. For example, histiocytosis and lymphoma.
Here, the diagram shows severe anterior pituitary hormone deficiency. The growth hormone defect in child decreases the growth velocity and causing short stature. In adult, it decreases the sense of well-being, increases fat mass, and decreases the muscle mass. Gonadotropin hormone defect in man causes loss of body hair, infertility, decreased libido, decreased vitality, and decreasing testicular size. In women, it causes loss of axillary and pubic hairs, amenorrhea, infertility, vaginal dryness, and breast atrophy. Thyroid stimulating hormone defect causes hypothyroidism. ACTH defect causes adrenal cortical insufficiency. MSH defect causes pallor. The pituitary gland hormones include ACTH, FSH, GH, LH, PRL, TSH, oxytocin. ACTH acts on zona glomerulosa, releasing middle corticoid, aldosterone promoting the following effects: increasing the blood pressure by increasing sodium reabsorption. ACTH acts on zona fasciculata, promoting the secretion of glucocorticoids, cortisol. ACTH acts on zona reticularis, promoting the release of androgens. This graph explains the functioning of ACTH. As our topic is hypopituitarism, we will be mainly focusing on the Deficiency of this hormone. ACTH deficiency arises as a result of decreased or absent production of adrenocorticotropic hormone by the pituitary gland. A decline in the concentration of ACTH in the blood leads to reduction in the secretion of adrenal hormones, resulting in adrenal insufficiency. The deficiency of ACTH results in severe fatigue, low blood pressure, frequent and prolonged infection, nausea, vomiting, abdominal pain, confusion. Growth hormone. Growth hormone is a protein hormone of about 190 amino acids that is synthesized and secreted by cells called somatotrophs in the anterior pituitary. It is a major participant in control of several complex physiological processes including growth and metabolism. Physiological effect of growth hormone. A critical concept in understanding growth hormone activity is that it has two distinct types of effects. Direct effects are the result of growth hormone binding its receptors on the target cells. Indirect effects are mediated primarily by insulin-like growth factor, a hormone that is secreted from the liver and other tissues in response to growth hormone. Growth hormone deficiency. Growth hormone deficiency, also known as dwarfism or pituitary dwarfism, is a condition caused by insufficient amount of growth hormone in the body. Children with growth hormone deficiency have abnormally short stature with normal body proportions. Growth hormone deficiency can be present at birth or develop later. The condition occurs when the pituitary gland makes too little growth hormone. It can also be the result of genetic defect, severe brain injury, or being born without a pituitary gland. Symptoms: slow growth or absence of growth, short stature, absent or delayed sexual development during puberty, headache, increased urination and amount of urine, excessive thirst. Facial abnormalities can be result in a small group of children with growth hormone deficiency. The gonadotropin hormone includes luteinizing hormone. The gonadotropin includes luteinizing hormone and follicle stimulating hormone. Luteinizing hormone, a hormone produced by gonadotrophic cells in the anterior pituitary gland. The production of LH is regulated by gonadotropin releasing hormone from the hypothalamus. In female, an acute rise of LH triggers ovulation and development of corpus luteum. In women, a lack of follicle stimulating hormone leads to incomplete development at puberty and poor ovarian function. In this situation, ovarian follicles do not grow properly and do not release an egg, thus leading to infertility. Follicle stimulating hormone is a gonadotropin, a glycoprotein polypeptide hormone. FSH is synthesized and secreted by the gonadotropic cells of the anterior pituitary gland and regulates the development, growth, pubertal maturation, and reproductive processes of the body. FSH and LH deficiency in women. Symptoms include irregular or stopped menstrual period and infertility. In men, symptoms include loss of body and facial hairs, weakness, lack of interest in sexual activity, erectile dysfunction, and infertility. ADH. ADH, also called arginine vasopressin, it is a hormone made by the hypothalamus in the brain and stored in the posterior pituitary gland. It tells your kidney how much water to conserve. ADH constantly regulates and balances the amount of water in your blood. Higher water concentration increases the volume and pressure of your blood. Osmotic sensors and baroreceptor works with the anterior diuretic hormone to maintain water metabolism. Osmotic sensors in the hypothalamus react to the concentration of particles in your blood. These particles include molecules of sodium, potassium, chloride, and carbon dioxide. When particle concentration is unbalanced or blood pressure is too low, these sensors and baroreceptors tell your kidneys to store or release water to maintain a healthy range of these substances. They also regulate your body's sense of thirst. Too little ADH in your blood may be caused by compulsive water drinking or low blood serum osmolality. It is the concentration of particles in your blood. A rare water metabolism disorder called central diabetes insipidus is sometimes the cause of ADH deficiency. Central diabetes insipidus is marked by a decrease in either the production of ADH by your hypothalamus or release of ADH from your pituitary gland. symptoms include excessive urination, which is called polyuria, followed by extreme thirst, which is called polydipsia. People with central diabetes insipidus are often extremely tired because their sleep is frequently interrupted by the need to urinate. Their urine is clear, odorless, and has an abnormal low concentration of particles. Central diabetes insipidus can lead to severe dehydration if it's left untreated. This disorder is not related to the more common diabetes, which affects the level of hormone insulin in your blood. Symptoms of hypothyroidism seen in TSH deficiency includes brittle fingernails, coarsening and thinning hairs, puffy eyes, pale dry skin, weakness and constipation, hoarseness, menstrual disorder, puffy hand, face and feet, thickening of the skin, thinning of eyebrows, increased cholesterol level, muscle and or joint ache and stiffness, slurred speech and decreased hearing.